All right, for the next item, as we have begun many a meeting for the past 2 years, we will have an update on our COVID-19 health and safety conditions within Henrico County Public Schools. Definitely these presentations have allowed us to keep pace with the many changes and mitigations as we've worked to prioritize the safety of our staff, students, and community. Dr. Tigan.
Good afternoon, Chair Shea, members of the board, and Dr. Cashwell. I do have a quick update for you this afternoon on COVID-19 health and safety efforts in Henrico County Public Schools. Today's agenda includes an overview of the recently released COVID community levels, a quick review of the efforts to host COVID vaccination clinics for students and staff, an update on our COVID testing efforts, and realignment of the volunteer guidance to these new community levels. Starting with the newly released community levels, it seems appropriate to begin with why the CDC and subsequently the Virginia Department of Health adopted these new metrics. According to our partners at the Virginia Department of Health, the changes were based on widespread vaccination combined with this entering a different phase of the pandemic. Thus, the new COVID-19 community levels are a composite of 3 metrics. The first is the number of new COVID-19 cases per 100,000 people in the past 7 days, which, as you may note, is a carryover from the previous community transmission levels. And this metric is combined with 2 new metrics. And these 2 new metrics are the 7-day total of new COVID-19 hospital admissions per 100,000 population and the 7-day average of percent of staffed inpatient beds occupied by COVID-19 patients. The chart on the next slide provides a visual as to how these metrics determine the current community level. This chart shows the interrelationship of the 3 metrics that are now used to determine that community level. Henrico County currently has fewer than 200 new cases per 100,000 people in the last 7 days, under a total of 10 new hospital admissions due to COVID-19 in the past 7 days. On average, over the last 7 days, less than 10% of the staffed inpatient beds were occupied by COVID-19 patients. As has always been the case with our metrics, we use the highest level to determine where we are. And you will notice that our metrics are within the green or low area. And so the current community level for Henrico is low. While this is wonderful news, it is important per the VDH that as a community, we remember that there needs to be a continued focus on vaccinations. Given the continued focus on vaccinations, an update on the various vaccinations clinics being held in Henrico County Public Schools seems to be in order. Today ends the first round of the school-based clinics at the remaining 16 Title I elementary schools. The second round of clinics will begin next week, and all second clinics will be completed by March 31st. Participation at each of these clinics has been strong. Due to the success of the school-based model, the health department will be partnering with school health services to offer the mandated vaccinations for middle and high school students as we prepare for the 22-23 school year. These include the Tdap, the HPV, and the meningococcal vaccines. As we look at the middle school efforts, the Saturday vaccination clinics at Fairfield and Elko middle schools were not met with great success this time. Each event yielded fewer than 10 people, so the follow-up clinics have been canceled. While some of the individuals received a booster and do not require anything else at this point in time, There were others who received their first dose and will still need the second dose of the vaccine to complete their primary series. These individuals have been notified by the Richmond Henrico Health Districts and directed to the Virginia Department of Health website to locate a nearby clinic where they may receive their second dose. Similar to the Saturday community clinics at our middle schools, the first two after-school sites where the Henrico Education Foundation, Henrico Police Athletic League, and the YMCA offered vaccinations and boosters, they were also poorly attended. It seems the demand within the community for vaccines and boosters is waning. This is not unexpected given the level of those individuals 5 and older who are already fully vaccinated. Even as the number of people 5 years of age and older who are fully vaccinated is nearing 75%, there continue to be some cases of COVID. The schools continue to provide access to COVID testing for those considered to be close contacts or those experiencing COVID-like symptoms. Since the Test to Stay program began on February 10th, of the students eligible to participate in the program, over 80% have opted to participate and remain in school, testing each morning and wearing a mask for 10 days. Those who opted not to participate indicated a variety of reasons. There was no consistent reason for non-participation. The VISTA program continues to make the Buy Next Now COVID-19 take-home kits available to families upon request or when their child is sent home from school with COVID-like symptoms. When students return to school on Monday, March 14th, school clinics will revert to allowing students to return to school in 24 hours as long as they have been fever-free for 24 hours without fever-reducing medication and they have a negative COVID test. The current availability of take-home test kits means families should not need to go to a pediatrician or testing site. Of course, that is always an option to our families. This shift in practice is based on Henrico's low community level, which is reflected in the reduction of COVID-19 outbreaks in the schools. Last week, there were 0 outbreaks across the 72 schools and program centers. There were also 0 positive cases identified through screening testing of athletes. This week, winter athletics wind down, so it is the final week of testing for the athletes and their coaches. Take-home test kits for staff continue to be available for every HCPS staff member. These test kits are rapid tests and are available at their school or work location. This is in addition to still having access to priority appointments for PCR tests at the county's test locations. While staff can normally request 1 test kit per week, they may be given additional test kits if they have been identified as a close contact, but intend to participate in the employee Test to Stay program. In addition, additional test kits will be made available to staff prior to spring break, should they want to test before heading out on vacation, or again, when they return. The final topic for today is related to volunteers in schools. At the last school board meeting, the volunteer guidance was updated to reflect milestones reached as a school division related to vaccination rates and testing availability. The Health Committee recommended transitioning from a 3-tier to a 2-tier system. The revised guidance was a result of examining and considering key factors to guide local decision-making, such as the number of student outbreaks, the vaccination rate of individuals 5 and older, and the availability of testing within the schools. This week, the Health Committee revisited the volunteer guidance given the shift from community transmission to community levels. Given the complexity of the community level metrics, the recommendation was to adhere to the 2-tier system, but align the tiers with the community levels of high, medium, and low. The chart here defines the tiers. Given Henrico's community level is low, volunteers may work inside or outside the buildings, including in classrooms, cafeterias, and gyms. Volunteers may work in proximity of students and staff. I think it's important to note that under the guidance provided at the last school board meeting, HCPS would be at this same tier 2 on the old system. This new guidance will also take effect Monday, March 14th. But as a reminder, school principals approve and coordinate volunteer efforts in their individual building. This chart represents guidance for administrators related to when and how volunteers may be used. And I'm happy to answer any questions you may have.
Thank you so much, Dr. Tayem. I will begin with Ms. Ogburn. Do you have any questions or comments?
I just have ask you to do me a favor. Sure. You said something about, I just want you to repeat a number. The results from testing of student athletes, I want to.
In the last week of testing,
yes,
which is this week, we had no students
was
test
the number.
positive.
Right, you said 0. I just wanted to hear it again. That's all.
0 outbreaks.
I just had to hear it again. Okay, thank you. Appreciate it.
You're welcome.
Thank you, Ms. Ogburn. Ms. Kinsella?
I appreciate Ms. Ogburn asking that question again for a point of clarity. 0, and is that the first time we've had
Yes, ma'am.
our athletes test, no one tested positive?
Yes, ma'am, that is correct. Very
just for
first
the
time.
record, it's the first time, which supports why we were testing in the first place, correct?
Yes, ma'am.
And other than that, I just a comment on the heels of that, watching the video that just addressed what we've done in response and didn't even cover everything we've done in response to the pandemic, but after the last 2 years. So I'd just like to ask Dr. Cashwell and the team to start working on maybe a video that shows everything else we've been doing in addition to all that we were doing in response to the pandemic.
That's a great point, Mrs. Kinsella, and I think you might have caught in the video ribbon cuttings for 3 brand new schools. You know, as we've unveiled our budget moving forward, that includes 2 new specialty centers, ACE expansion. There is no doubt that while working on all things health and safety related to the pandemic, we have kept incredible momentum moving forward in service of our students. And this board's dedication and making sure we kept our eye on our strategic goals has been really incredible. So kudos to you all for that, and we look forward to continuing to shout out all we've continued to do and all the big plans we have going forward.
Can you not forget the new Virginia Randolph with the Toy Centers? I mean, I just want to.
That's right.
why I'm
That's
asking.
right. The list is a long one to everyone's point. And I mean, the efforts that have been championed by this board and the incredible work of our team, not only to respond to the here and now, but always keep an eye on our student needs and planning for the future and what's next in service of the HCPS community has been tremendous and is something we can all feel really good about. And so we would absolutely highlight that.
Okay, I appreciate that, because we have been working on other things, not only current needs, but also looking to the future, planning for the future, as Reverend Cooper said, with our 2 new specialty centers, as well as the Academy at Virginia Randolph. There's so much more leadership and the board have been working on, and our leaders in our schools and our teachers and staff. So I just like for that to be the next highlight we see. That's all I had, Madam Chair.
Thank you, Reverend Cooper.
Madam, so thank you again, Dr. Titan. A couple of quick questions or comments. Referring to slide number 7, thank you for providing the protocol and creating a visual for countywide volunteer guidance, so thank you so much. Since implementation of the countywide guidance ultimately rests with each school principal, could you share some examples of the types of school-specific conditions that would inform a school's volunteer tier?
It could be a result of one specific thing would be the needs within the school, as far as some schools may need volunteers to help with a specific event, where other schools might be involved with testing or something that at this point that it would not be appropriate to have additional volunteers in. And that would be a site-by-site type situation.
Okay.
So.
I appreciate that.
That's a one.
Yeah, no, and so in that same vein, will principals also have the flexibility to require masks of volunteers at any time?
We have gone with, mask in buildings being highly recommended, and we continue to highly recommend the use of masks in our schools.
And then the last question, how will these new guidelines be communicated to potential volunteers?
It will be shared with County Council of PTAs, it'll be shared with our principals, and it will be shared through our newsletter that'll go out tomorrow to our families, and it'll be posted on the website.
Well, thank you so much.
You're
Madam
welcome.
Chair.
Thank you so much. I know the families in my district will be very excited about these new volunteer guidelines. That's something I've gotten continuous feedback about. And I'll give some positive feedback that I've heard directly from our most important stakeholders, our students, about the adjusted recess guidelines from 2 weeks ago. Already lots of excitement to be able to see other peers in their grade. So that's great to hear. Just want to a couple points of clarity around our vaccination clinics. Who provides the vaccination at our vaccination clinic? Is it our school nurses or is it the Department of Health?
It's actually has been a vendor that was contracted through the Virginia Department of Health. And so it is
really,
not our nurses doing any of the vaccination efforts.
So really Henrico's involvement is providing a location and providing access, and then
We're the conduit to really explain to families what's available should they want to opt to have their child vaccinated at school. That some of our families' transportation's an issue, and so access varies. And so it's just been an avenue that families can easily access if they choose to.
perfect. I think there's been a little bit of confusion around that over kind of where the staffing comes from, and is it taking away from the students in our buildings? And the answer is no.
No.
We're just providing a location.
Our nurses have remained in
access.
their clinics serving their students during these clinics.
Wonderful. And then you said this, but I just want to repeat it and highlight it for those who may have just been half paying attention. You talked about the success of those in-school vaccination clinics and expanding that to mandatory vaccines in secondary. But I want to be very clear that everyone hears us. The COVID vaccine remains not mandatory.
Correct. It is strictly voluntary. There is no state mandate for that vaccine, but there are state mandates for other vaccines for students.
So these are the vaccines that have already been mandated prior to COVID. We're just providing an access point.
Yes.
Perfect. I just want to make sure everybody heard that clearly, since it was during conversation about COVID that someone didn't halfway hear it and take it out of context. So
Yes, I think it's just important to understand that the relationships that have been forged and the processes that have been developed, the seeing that success has enabled the Virginia Department of Health and School Health Services to think differently about other things we do that just makes things easier for our families, especially those that, again, have challenge with access.
Thank you. Colleagues, anything else? Thank you, Dr. Teigen.
You're welcome.
All right, thank you.